Can cabbage cause thyroid nodules? Can almonds shrink them? Should you stop eating cauliflower? Why are thyroid nodules much more common in women? These are the most common questions which many patients ask. Let's separate today myths from science. Have you been recently told that you have a thyroid nodule and you're wondering what caused it? Can food shrink it? What food should I eat or avoid? The first and most important thing to understand is once a thyroid nodule is formed, changing your diet doesn't make the thyroid nodule disappear. Many people spend time searching for a miracle food or a special diet which can shrink the thyroid nodule, but unfortunately, scientific evidence does not support it. However, healthy food is still important to maintain a healthy thyroid health and overall hormonal balance. So, what actually causes thyroid nodule? Honestly, in most people, there is no single cause. Let's see the causes. Firstly, genetics. If someone in your family member has a thyroid nodule, your chances might be higher. Second reason, hormonal influence. And this is one of the reasons why women are more prone for thyroid nodules because women experience significant hormonal changes during puberty, during pregnancy, and during menopausal status. These hormonal fluctuations can influence and increase the likelihood of nodule formation. And then you have iodine imbalance and then certain thyroid disorders. Now let's talk about the food. Remember, food supports thyroid health but does not remove an existing thyroid nodule. The thyroid does not need only iodine, it also needs nutrients, proteins, iron, selenium for healthy thyroid hormone production and metabolism. Many Indian women have iron deficiency, and iron plays a very important role in thyroid function. Instead of chasing thyroid miracle foods, focus on overall nutritional quality. Include your diet with adequate proteins from dal, sprouts, eggs, fish, curd, paneer. Use iodized salt in recommended amounts. Vegetables such as leafy greens, carrot, cucumber, bottle gourd, beans, and pumpkin. Good sources of selenium include Brazil nuts, fish, sunflower seeds, tofu, baked beans. Now, an important thing about cruciferous vegetables, and these have been called goitrogens. Many people ask, Doctor, should I stop eating cauliflower, cabbage, broccoli, radish? The answer is no. These vegetables are healthy and can be eaten by most people. However, if consumed in large amounts and in raw form, they can slightly interfere with iodine utilization. Therefore, it is better to cook or boil them rather than eating them in excessive quantities and in raw form. What should you avoid? Avoid junk food, ultra processed food, sugary drinks, sweets, and smoking. If you have a thyroid nodule, the most important step is not just diet alone. You should get a proper evaluation with a thyroid ultrasound, thyroid function test, and if required, thyroid FNAC, that is a needle testing. It is also important to consult your endocrinologist or a qualified nutritionalist because the dietary requirements may vary from person to person. And finally, if your thyroid nodule is causing a visible swelling, anxiety issues, cosmetic issues, compressive symptoms, remember surgery is not the only option. Thyroid nodule microwave ablation is a non surgical method of treating thyroid nodules wherein a small needle shrinks the thyroid nodule without removing the thyroid gland and thyroid function is preserved. An important point to remember is how good you maintain your metabolic health. Every meal you eat, every walk you skip, every late night you stay awake, and every stress you carry influences your metabolic health and hormonal balance. So, it is very important to protect your most valuable asset, that is your metabolic health.